tracking this little sinusoidal wave on a computer screen while talking at the same time. And he finds the same thing, that if you're accurate tracking the little waveform on the screen, you're not accurate with talking. You're almost down to a whisper and you can't raise your voice. If I stop you from having to track, your voice will come back up to normal. So this whole interest in kind of dual tasking and this interaction between cognition and thinking and moving and speaking is probably the newest area of research that people are moving into because it's real life. None of us are ever actually doing one thing at a time. We're all either thinking about something else, or we're distracted by something else, or you're encountering a new situation, or you're meeting someone new, you're not paying attention, all of those things that add demands that force your walking speed to get slower, that force you to have reductions in balance, that force you to have poorer speech intelligibility, and that cause you to have more pausing and disruption overall in the types of language or the types of words that you're able to use. So this is a little bit about the direction I'm going to talk about today. Because, as I'm going to address a little later on, we went through this whole kind of trend where we said, dual tasking is bad. Nobody should do it. So people who have Parkinson's disease should walk but not talk to anybody. How exciting is that? They can go from point A to point B, but don't give them a teacup. Don't interrupt them along the way. Don't have them look at anything else. Don't ask them to remember anything else. Don't do anything but walk. And so there's this whole aspect of literature that has come out really over the up until about the last 2 years that has said dual tasking is absolutely bad. Therapists and doctors and nurses should tell people with Parkinson's absolutely do only one thing at a time and that's it. Well, people with Parkinson's weren't very happy with that advice because it wasn't very practical. And in essence, if we said that, we said, well, you shouldn't be driving, you shouldn't be doing a whole host of other things, you shouldn't be singing while cooking, you shouldn't be, and there's nothing really enriching about quality of life if you have to live that way. And now there's this whole realm of researchers, myself included, who are actually looking at using dual tasking as a rehab avenue. So not taking away, but actually forcing people to do activities in a dual tasking way, so walking and talking, thinking and walking, speaking and doing something else, as a way of actually rehabilitating or challenging the system. And I'll go over a little bit of that research in a bit because we're actually finding that that's a really effective way to treat people. And we can make them better, not only at thinking and walking or speaking, but we actually make them better at both aspects. They get better at walking and thinking. They get better at speaking and thinking. So we're starting to get away from that ignorant thing that we did, where we said, absolutely no, you shouldn't do any of those things. And now what we're saying is, you should be cautious, you should be aware that you may be at a higher falls risk when doing those things, but there may actually be some benefit in treating or doing rehab or exercising in a way that uses both. And so that's kind of why I'm here today, not to take things away, not to spread the gloom and doom of cognitive decline in Parkinson's disease. I often get accused of that, but to actually hopefully add a little bit of light and encouragement on things that we may be able to do in the exercise realm and in the brain training realm that may help with this avenue of cognitive impairment. So we know that exercise is beneficial. Did you guys know that? It's good for you? Yeah. So exercise is beneficial in both younger adults and exercise is beneficial in older adults. And I'm not going to talk so much about the fact today that makes you move better. I want to talk about the fact that it makes you smarter. And so we know that people who do particularly aerobic exercise or cardiovascular exercise actually do better on cognitive tests. So those of you who have also come to see me know that I give you puzzles, clocks to draw, mazes to go through, all kinds of really exciting stuff. But those are things that tap into or measure different processes in the brain. And what we know is that the more exercise you do, you actually are smarter. You do better on those tasks. We know that physically fit adults, as well as PD patients who are physically fit, both coming into their diagnosis and also who maintain physical fitness during the course of Parkinson's disease, actually do better on cognitive testing. We know that chronic exercise in older adults actually helps with brain connectivity. Now, that's a big word. What is brain connectivity? Your brain and the different aspects of your brain and the different cells in your brain do not operate in isolation. Think about it as a whole mess of superhighways in your head, and that's actually what it is. Matter of fact, my favorite, is anybody eating? Nobody's eating, right? Okay, because I'm about to go gross, okay? When you dissect the human brain, which I've had the opportunity to do, and you open it up and you actually look inside, do you guys know what string cheese is? Like string cheese that you pull, that people eat? That's what it looks like on the inside. So all those cute little pictures that you guys get that have curves and bumps on the brain that you see, that's only the surface. When you actually get beyond about that much of the brain surface, you're actually looking at string cheese. And those are the superhighways in the brain. It's those pathways, those fibers that connect all the different aspects of the brain together that let you function the way that you do, quickly, efficiently, and smartly. And what we know is that's connectivity. Those superhighways and how well they work are what we talk about when we talk about brain connectivity or brain plasticity. The better those highways, the less likely you are to develop any cognitive decline of any form, be that dementia, a vascular type, Alzheimer's dementia, Parkinson's disease dementia. We know that if we can keep those highways healthy, we can keep your brain healthy. And we know in particular that chronic exercise in older adults preserves those superhighways. It helps to maintain that connectivity. And there's really no reason, although we don't have great evidence yet, there's really no reason to think that that should be any different between people who have Parkinson's and people who don't have Parkinson's. We also know that regular exercise in mid and late life, so particularly between about the ages of 30 and 50, so I'm already way behind, but between the ages of 30 and 50 actually reduce substantially your risk of developing dementia or your risk of developing cognitive decline. We don't have good evidence yet, although there are a couple of studies that do show that people who exercise regularly in the 30 to 50 age range are at less likelihood of even developing Parkinson's disease. So some very early studies that show that. It is not clear yet, the evidence is not solid yet, but we do have early indication that that's the case. So this is just a little bit of a slide. When we do research, sometimes one of the problems in research is that everybody's doing it differently. So everybody's doing a different task, everybody's looking at different things, everybody's looking at different patients. And sometimes we get fortunate enough that someone does what's called a meta-analysis. So they throw all the research in a big pot, and they look at it as if it was one research study. And there's a whole host of complicated kind of statistics and formulas that go with that. But this is a meta-analysis that was done in 2003, and this is a graph from that study, that looked at the benefit, the overall benefit on cognition from exercise in older adults. So the blue are people who didn't exercise, and the red are people who do exercise. So it doesn't take a rocket scientist to tell that that's a big difference, right? So people who exercise do drastically better on all measures of cognition, but the one that's really important is the one that I've circled, which is something called executive function. So executive function is your ability to plan and regulate goal-directed behavior. So when you want to do something, walk from here to there. When you want to do something, make a peanut butter and jam sandwich. When you want to do something, plan out something that you want to say to a loved one. That all requires executive function, and it is the particular area that is impaired in Parkinson's disease. So memory is more impaired in Alzheimer's disease. But in Parkinson's disease and the cognitive impairment that occurs with it, this notion of executive function or goal-directed, oriented, planned behavior is what is affected and affected most pronouncedly. Exercise has the most direct benefit on the area of executive function. And this has been shown in dementia patients. This has been shown in people who are just older adults who don't have any cognitive impairment. And it's also been shown in Parkinson's disease. So we know definitively now that exercise benefits the exact area that we actually need improvement in cognition for individuals who have PD. Even once patients develop, and not necessarily Parkinson's disease dementia, because we don't have the exact evidence we need for that yet, but in individuals who have dementia of the vascular kind or Alzheimer's disease, exercise continues to have benefit even after that diagnosis sets in. So we know that people who exercise, who have Alzheimer's disease, do much better than people who don't exercise. They live longer. They have a better quality of life. They actually get better from a cognitive aspect, better beyond what regular medicines do. So people that we give medicines for Alzheimer's disease to, and we also have them exercise, don't just stay at the same level. They actually improve with regard to their cognitive functions. And we know that in Alzheimer's disease in particular, that brain atrophy is actually less in people who exercise than people who don't exercise. So this isn't just I feel good, I move better. Exercise may very well have this brain-altering connectivity piece that affects how well we're able to think and how well we're able to function. This is a little bit of a graph. This isn't new to any of you guys who have Parkinson's disease, but it was published late last year by Spielman and Bas Bloem's group in the Netherlands. And I'm bringing it up because there's a really neat study going on right now in the Netherlands, published by the National Parkinson's Foundation in the US, that is looking at the best way to have people with Parkinson's exercise. So we know exercise is important. I'm going to go over some of their data a little bit later in the talk. We know exercise is important, but we know that presently the way we're teaching people with Parkinson's to exercise is probably not correct. And so part of this study is to look at, if we know it's important, if people with Parkinson's know it's important, then why do we have this huge gap between knowing it's good for us but not being able to do it? Especially if we're saying it may modify disease, it may physically make you better, and now I'm telling you it may cognitively make you better, and yet we're still not able to bridge that gap. So that's what this group in the Netherlands is looking at. But this is a graph in a paper that they put out the end of last year, just talking about this vicious cycle of individuals with Parkinson's disease having trouble moving, which makes them more sedentary. As they become more sedentary, they develop more depression and apathy and cognitive decline, and it just becomes this vicious cycle that makes it harder and harder to get out of to begin to exercise. So we do have some light at the end of the tunnel. The PARC-FIT study should be done in about a year, but their data demonstrates it with a really good prescribed approach to exercise, not just kind of going to your doctor's office and saying it's good to exercise, but with a very prescribed approach specific for Parkinson's disease. Their patients are getting better not only physically, but also getting better cognitively. So hopefully next year, if you have me back, I can fill you in on that study. So what do we know about research, exercise, and cognition in PD? So in the normal, healthy, aging population and in Alzheimer's disease and dementia, if I combine all of those studies, we are talking about thousands of studies now that talk about exercise benefiting cognition. Do you know how many we have in Parkinson's disease? Probably less than 10. So the focus in Parkinson's disease to date for exercise has been how it changes us physically, how it makes us move. We are still facing the bias that Parkinson's disease does not involve cognition, does not involve language, and as such, the exercise studies that have all been done to date do not look at those as outcomes. And we've missed a golden opportunity that our colleagues who do research in Alzheimer's disease and research in just normal aging have known for a long time, which is it makes you think better, it makes you smarter. But we don't have a lot of that data in our own field because we simply haven't looked at it. It may very well have been working wonders, but we can't say that definitively because we just haven't looked at it. So literally, when I ran the literature review for this in a little article that I wrote earlier in the year on this topic, less than 10 articles, I ran that lit search probably December, January,